The rural city of New Ulm, Minnesota, population under 14,000, is the partner in a groundbreaking initiative aimed at reducing heart disease by preventing cardiovascular problems before they appear. It's called the Heart of New Ulm Project, and today we'll explore what makes it tick. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, senior writer for the AHA and your host. This podcast, part of a series from the Value Initiative, is a four-way conversation about the goals, methods, and outcomes so far of the Heart of New Ulm project. Julia Resnick is senior program manager for the American Hospital Association. Carissa Bugler is director of operations at the New Ulm Medical Center. Rebecca Lindberg is Director of Population Health and Professional Education at the Minneapolis Heart Institute Foundation, which is collaborating with the City of New Ulm on the project. And Cindy Winters serves as advisor to the Heart of New Ulm project. Let's join their discussion.
Carissa, Rebecca, and Cindy, thank you so much for joining me today. Let's jump right in. So, the Heart of New Ulm project has been in existence for about 10 years. Can you share why you decided to start this initiative in New Ulm?
This is Rebecca. The vision of the Heart of New Ulm project was a vision by a preventive cardiologist, Kevin Graham, who was practicing at the Minneapolis Heart Institute Foundation, as well as a researcher here at our foundation. He actually understood that 20% of health is actually influenced by the clinical care that a person would receive, and understood that 80% of our health is influenced by things that happen outside of our clinical experience or outside of the hospital. And he had a vision that what if we could not only provide excellent care at the clinical level and at a hospital level, but what if we could also intervene across an entire community to improve cardiovascular health? And he approached the CEO and president of Allina Health, which was the health system that he practiced under. And he and the CEO actually envisioned this project, and they joined in partnership and asked the Minneapolis Heart Institute Foundation to lead the research project. And our partners are New Ulm Medical Center, as well as the community of New Ulm. And New Ulm was an ideal community to actually engage in this type of research project because they were using the electronic health record at the time, but they also had over 90% of the residents of New Ulm sought care at New Ulm Medical Center. So it was a population that we could follow over the 10-year research project.
And could you tell us a little bit about New Ulm?
Carissa, do you want to take that one?
This is Carissa. New Ulm, Minnesota is a community of nearly 14,000 individuals. We're nestled into the Minnesota River Valley in southern Minnesota. We have strong school systems, good retail services, strong chamber, many faith-based organizations in the community, but was founded by Germans. So it's added some fun to our discussions over the years of culturally making changes, sustainable changes where the healthy choice is the easy choice in a community where beer, brats, and butter were often joked as being some of the staples in our community. So although every community has, culturally some fun things or some maybe challenges that you're looking to change, New Ulm certainly had those as well.
That is really great insight to the community that you're working in. So I know that you all have been working on building a culture of wellness in New Ulm. Can you tell us a bit more about the work that you've been doing in this space, what you do, and how you do it?
Yes, this is Rebecca. And, when we initially embarked on this project, we realized that building a culture of wellness takes time and it takes a collaborative effort across the community. We also realized that health is influenced by more than just our individual decisions, that it really is a composite of our individual decisions, who we socialize with, what community we live in, and how that community supports our health, as well as our policies, our systems that we're a part of, and the environment in which we live. So when we started thinking about how do we build this culture of wellness in New Ulm, we looked to the research and decided to use the social ecological model as our framework for our interventions. And the social ecological model is a prevention framework that considers the complex influences on health. And so we really looked at how do we not only work with the medical center and provide resources there for people, but how do we look out into the community? And so we worked with restaurants and grocery stores and convenience stores. We worked with the city to influence policies. We've looked at how do you change roads to be more walkable and more bikeable for the people. We really wanted to make it easier for people to make the healthy choice where they live, where they work, where they play, where they socialize. So that became our framework for the project.
Can you speak a little bit towards who you've been partnering with and how those partnerships were established and have evolved?
This is Carissa. We knew at the onset of especially when we were talking in the community about what would a community look like if heart attacks were eliminated or significantly reduced. We knew that if it was just the medical center or just the Minneapolis Heart Institute Foundation, communicating in the community what you needed to do, if we didn't have partners supporting that messaging and helping to carry out what the best practices were, we knew that that was a critical success factor for us and it would not be successful. So from the onset, we identified different organizations who could be partners and would eventually help someday lead the work around creating a healthier environment and helping support individuals make healthier choices. So today, that has evolved into a leadership team of 12 members. They represent different sectors of our community, such as city government, our schools, public health, our chamber, different work sites or employers in the community, and then, of course, our medical center and our medical center foundation, but also the Minneapolis Heart Institute Foundation. Under this leadership group, we have 10 different action teams, and they range from a food environment action team, a mental health wellness team, safe routes to schools, worksite wellness, and each of these action teams are comprised of volunteers in our community who spend their time helping create work plans and implementing those work plans to help each of these action teams be successful in the work that they are doing. In addition to all of that, I think we have nearly 80 individuals who serve in some formal capacity as a volunteer for the Heart of New Ulm initiative. In addition to that, it takes support from the overall community, a willingness that the status quo that we've been facing for, prior 10 years ago of facing continued growth in chronic illness and seeing our loved ones maybe facing a chronic illness diagnosis or unfortunately a heart attack, that we didn't want to stand for that any longer. And if there was action that we could take to change those results for our community, we were all going to be a part of that. And the results are showing that we did have our community engaged and continue to have our community engaged in this initiative. So partners are definitely the foundation of our success.
And I'll just add to that, this is Rebecca, as a research foundation, a research and education foundation, it was really important to us as we embarked on this 10-year research project that we were just not a research study that came in, that we did the work and then left after 10 years. We knew that wouldn't be sustainable. And it's really been this collaborative effort that has allowed us to build these partnerships, to go from being kind of leading the project at the initiation of the 10 years to actually becoming more of advisors to the project over the last 3 to 5 years, because the community has become so engaged and really taking ownership for the work that's been happening in the community, that although the research project ended at the end of 2018, it's something that will continue in the community. And I think that speaks to the importance of having these partners and working alongside them to really look to them to take ownership of the work.
It sounds like the research was really the catalyst for it, but then the community took it and ran with it.
Exactly.
You alluded to this a minute ago. So it's been 10 years and the research study has ended. What impact are you seeing that the Heart of New Ulm project has had on your patients and on the community?
This is Carissa. Our goal has been to improve outcomes of our patients, but also, of course, of the overall community. And we've done that in a lot of different ways of changing the environment and increasing knowledge. And we've seen some exceptional results that we're really proud to share with you all today. From our patients, we use our EMR. There's many ways that we're gathering data to determine how we are improving outcomes of our patients, but we use our electronic medical record as one of our most viable resources of data. And over the past 10 years, we have glucose down 11% in our patient population. Patients who have a high LDL is down 11% as well. Patients who have high triglycerides are down 7%. We have 6% more of our patients who have their blood pressure at goal. And we've seen the average everyday smoker, that percentage amongst our patient population decrease by 4.5%. Alongside of these, we've also seen through surveys in our community, we've seen physical activity increase, and we've also seen fruit and vegetable consumption increase as well. So our president likes to tell the story, and I think you hear in the community of, but I see it. I see people out walking. I see our local city-owned recreation center within just a couple of years grew the number of members by over 60%. And when you see some of those other things happening in the community, it feels different. You can say these numbers are great, and clinically, from a patient perspective, that's what we really want to see, is helping our patients prevent chronic illness. And then if they unfortunately are diagnosed with a chronic illness, that they are managing it well. But in addition to all of that, when you actually see it, feel it, hear it from community organizations and our partners, that things are evolving and continuing to change, we know we've really seen success in a lot of different areas.
Yeah, and I'll just add to that. I think, we've also heard anecdotally that people are choosing to move into the community because the community has changed, and there is this sense of supporting health that is a true value to people. So a recent physician that just started at New Ulm Medical Center stated that was one of the reasons that she wanted to practice in New Ulm and bring her family to New Ulm. And we've heard that from businesses who have opened their doors in New Ulm when they were looking at multiple communities, because there was this support for the work that they do. I think the other thing from a community perspective that's been so rewarding to see is how decisions have changed and are being made across the community. We really did a lot of work as we collected the data through the research to really start using the data to arm the community leaders, influencers, our action team members, so that they could bring that out into the community. And so they could actually inform when decisions are being made, bring the data to the table. So health was included in those decisions. So for instance, the electronic health record was used to map a risk across the community. And then that was given to our leaders out in the community. And so when they were working with organizations like Park and Rec, instead of decisions being made by the Park and Rec department, based on who was at the table and who were the loudest at the table, they could really look at the risk in the community and then talk about parks and resources and think about health in that decision making. And it's really changed the way decisions have been made most recently across the community.
It is really exciting to hear these results and hear about the culture changes that you've all been experiencing New Ulm. So I'm just really curious, what do you think are the key things that changed in the environment that allowed you all to have these results?
So this is Cindy, and I think it's just starting the conversations and providing education and awareness to the residents and the key decision makers in the community that, yes, they have a role to play in their health and what that role can be, and that our environment does impact the decisions that we make around our health every day. And I think we just get so ingrained in our daily lifestyles and business of getting through the day that we don't realize how our environment impacts those decisions that we make. So starting those conversations, having small demonstration pop-up projects to show what the difference could be and how it impacts our decision-making processes, and then just getting the community residents together around an initiative that they're interested in. Our Safe Roads to School program was something that was started about the middle of the 10-year project, and it started because the adult residents of the community were like, well, what are you doing for the kids? Well, kids really weren't our target population in this project because kids don't tend to have heart attacks. But with the Safe Roads to School program, we were able to make changes to the built environment, make it safer for them to walk and bike, which impacts the adults in the community. So getting them together around making it safer for kids to walk and bike also helped them as well. And the changes have been small, but they've been consistent and they've been gradual. And I think it's just that gradual push, that gradual don't let it go, just keep bringing it up. It helps people start to think a little bit differently.
That is great insight and a great transition to my next question. What are the most significant lessons that you've learned on your journey so far?
So this is Cindy again, and I would say that this work takes a long time, and you need to take it small steps, and you need to ensure that the right people are at the table. You may have the right organizations at the table, but is it the right person at the table? The people need to know what their roles and responsibilities are when they're at the table. They need to be willing to take that information back to their organization and then talk about how their organization can support the work. When I first came to the project, there was a lot of community buy-in. And when I say buy-in, it means that the community was participating in our project. They supported the project. I didn't feel like there was a lot of really ownership. I think they felt like it was a hospital program, something that the hospital was doing for them, and they wanted to support the hospital. Well, that's really not sustainable over the long term. So we really started talking about it as this is a community project. This is community owned and driven. And you all have a role and responsibility to play in what we're doing. And so we really worked with the leaders around the table to help them understand that and made sure that we had the right leaders at the table that could help influence the key decision makers. We maybe didn't have the key decision makers at the table. And if you can't get them to the table, who are their confidants? Who do they listen to? Who do they trust? And then you start talking to those people because they can help influence the decision making. We have a really comprehensive communication strategy throughout the project that has helped give the message across all avenues of communication. So patients, residents were hearing the same message everywhere they went. It wasn't segregated as according to a particular program or a particular project. It was a unified message. When we work with our partners, we really learn to understand and speak our partners' language and learn what motivates them. And then we work to wrap health around that motivation so that we aren't trying to have them focus on health, but what's really important to them, we allow them to focus on that, and then we help wrap health around it so they understand how it all fits together. So it does become a shared value across the community.
Those are great insights. Rebecca, Carissa, anything else you wanted to add?
I would just add the value of your partners and then really listening to one another. I think it's easy to come in with an agenda and things that you hope to accomplish when you're doing this work. And I think those of us who come from the health side of things come with the science, and oftentimes it's this perfect balance between the science and then really listening to your community partners and the community at large and understanding, okay, how do we adapt the science and the theories into what will really work in the community? And that takes a lot of patience, and it takes a lot of listening and really valuing your community partners, the community residents, and the insights that they bring to the table. And I think we tried to do that throughout the whole 10 years. Is we just didn't roll things out. We really brought them to the community, listened, modified them, changed how we talked about them and messaged to the community so that they were better received in the community and by the people we were trying to reach with what we were doing. I think that was a real strong thing that we learned, and it's important to slow down and do that.
This is Carissa. I think Rebecca and Cindy made some excellent points around partnership and not going into a project assuming how you're going to get to the end result. I would add to that, believe in your community and believe that change can happen. Because as Cindy shared, it's slow. You have missteps. You have initiatives you throw out that do not work, do not show the outcomes you were hoping for. And it doesn't necessarily mean failure. It means improvement, just not what you were expecting. So kind of changing the lens on always having that outcome in mind of what we are striving for as a community to improve the overall health, that it's zigzagged the way that it doesn't always intend. But believe in your community, engage them, listen to them, as Rebecca shared, and allow them to help shape. I hear what you're saying, but for our community, this is what's going to work better, and they will know. And that is truly how I think when you listen and incorporate that into the planning and the implementation is when success and harmony and then sustainability follows.
So looking forward, what are your future plans for the Heart of New Ulm project?
Well, this is Rebecca. I can tell you a little bit from the Minneapolis Heart Institute Foundation side. We wrapped up the project in 2018 from a research standpoint. So we have a team that's looking at all the data now, and we will be publishing that data. But, people that are interested in the work that we've done to date, we have 23 peer-reviewed journal articles that have been published and are available on our website. And we're really hoping that the research that we have done can really help support and inform other communities in doing this work. And because we know that it's challenging to really rally support for the work that's happening across the country. And we're hoping that this research can really serve as valuable to other communities, that they can use our research to really advance the work that they're doing. Secondly, we've launched what we're calling the Rural Health Transformation Center, and we're providing services to other communities that are running up against barriers or challenges or just need support in doing this type of work. And we're really hoping that what we've learned over the last 10 years, that we can really now educate other communities in doing the work. Because one of the keys and goals of our foundation and the research that we do is really how do we then share that research, translate the research, disseminate the research to other people so it can be beneficial, not just in the journal article, but really be beneficial in transforming the health across the country.
This is Carissa. Minneapolis Heart Institute Foundation has been an exceptional partner for us, providing expertise and support along the way. So as excited as we are as a community that the project is transforming from a research project to a community-owned initiative has been exciting and a little scary at the same time. So we've taken a lot of steps to maintain that partnership with the Minneapolis Heart Institute Foundation, continue to look to our partners to continued or even larger role in helping sustain the initiative. Funding is always a challenge, and we're part of that. We have, how do you continue to fund preventative and even some type of community health improvement work? So we have partnered with our New Ulm Medical Center Foundation. They are a significant funder to our initiative over the next 3 years as we transition the project to community-owned. But we will continue to look to our partners and find other creative ways to fund the initiative. We can't let go, and our leadership committee has been firm. The investment that our funders over the past 10 years and the investment that the community has made in this initiative, this is not the time to stop the momentum and the efforts that are showing these great outcomes and that are improving lives here in our community. In addition, it helps living in a rural community. 1 in 5 hospitals that are in a rural community are financially struggling. Most people in the United States want to live in a metro area. This helps us stand apart as a community of, we can be a hotbed of innovation and wrap our arms around what community means. The Heart of New Ulm initiative is too much of an important initiative in our community and the impact that it's made to not put everything that we have into sustaining the efforts that we've made over these past 10 years. So it helps improve the quality of life in our community. As Rebecca shared earlier, it helps with retaining and recruiting new physicians or other healthcare team members who are proud to say, my community makes health a priority. So we're excited for the future. We think we have a great plan that we're working on developing over the next 3 years that really creates a more sustainable model. We're appreciative to continue to have the support of the Minneapolis Heart Institute Foundation. And we're excited to share with you again in another 10 years, even better improved health outcomes for our community.
Well, I am certainly inspired by the impact that the Heart of New Ulm project is having on the New Ulm community. And my big takeaway for the day is that you need to believe in community and believe that change can happen. I think that's a great mantra to go through life with. So with that, I want to thank you, Carissa, Rebecca, and Cindy for joining me today and sharing more information about your important work in advancing health in New Ulm. This has truly been an excellent example of how hospitals can partner in their communities as part of a population health strategy to improve quality patient outcomes and the patient experience. For more podcasts and additional tools, resources, and education to help you advance affordable healthcare and promote value in your community, please visit the Value Initiative's website at aha.org/The Value Initiative. This concludes our discussion today. Thank you again to Carissa Bugler, Rebecca Lindberg, and Cindy Winters, and all our listeners for joining us.